according to the CDC, among children, the mortality risk for COVID is lower than it is from the flu. And that they say it's less than, you have less risk if you're under age 18 of dying from COVID than you do of dying from pneumonia, of dying in a car crash, of dying from drowning, of dying from heart disease, of dying from suicide, of dying from homicide, of dying from a birth defect. We could go on. And yet still, we're at a situation here where we're looking at not just mandatory vaccine or mandatory mask mandates returning to cities, but schools. We're moving to Connecticut. The Connecticut governor still has a mask mandate in place for all children inside schools. And so when our kids go back in September, they're going to have to wear masks. Our little kids in the single digits and, 10 and 11. For what, right? For what? There was a great piece in New York Magazine last week saying the kids are safe. They always have been. This is theater.
Well, look, if you look there have been some studies published in the New England Journal coming out of Sweden and coming out of Iceland. Sweden was criticized consistently throughout this pandemic for not taking enough actions, for not requiring lockdowns, for not requiring masks in schools. But what they found is they had 1.8 million kids in schools over a several months period, and not a single kid died. And the risk of infection and death for the teachers was no higher in school than it was in multiple other occupations. So the schools were not where it was a problem. And same thing was seen in Iceland. You did not have high rates of disease and deaths, and certainly severe illnesses in among school children or among the school population. And we've seen that here. I mean, every indication is that schools are not where transmission would be taking place, and that the cases that are being seen in schools are cases that were probably brought in from the outside. People were infected outside the school, came to school, and that's where the diagnosis took place. That's
So
not where the
why
disease transmission.
Why don't our health officials sound like you, right? Why does the American Academy of Pediatrics say the kids should all be masked if they're over age 2, even if you have a kid who you've chosen to have vaccinated? They should be masked. And Fauci taking it beyond children, saying, yeah, you know what? We're seriously looking at mandatory masks coming back, even for the vaccinated. We think that's where our public health officials are going to land. And even a former Biden administration, his former COVID-19 response coordinator, the guy just left the office, said, we're going to look at more vaccine mandates. They're very likely coming soon. We think that they should be at the municipal level, the state level. Employers should do it, venues, government agencies. So we're hearing from our public health officials, mask mandates are returning, vaccine mandates are returning. That doesn't reflect anything you just said.
Well, what's the purpose of a mask? The purpose of a mask is either to prevent the spread of disease or to protect you from becoming infected. If you're vaccinated, you have very high protection. You probably do not need a mask. All the approved authorized vaccines seem to protect against the transmission of disease quite well, better than any influenza vaccine we've had in recent years. Moreover, in the cases where people have so-called breakthrough infections, where they become infected after being vaccinated, the cases are nearly uniformly very mild. The viral titers those people have are lower, so they present less of a risk to transmit it to others. So it doesn't really make much sense for people who are vaccinated to have to wear masks.
And yet, here we are.